What's up, guys? Welcome to another episode of the Dr. Akash Show. My name is Dr. Akash Bajaj. I am a triple board certified physician, and I focus specifically on helping you build rituals and routines to keep you resilient and robust. We take all of the current trends and all of the current information that we have, filter out all the BS, and leave you with practical, free, or inexpensive tips and tricks that you can apply immediately after this discussion to help optimize your life for the future. So today I want to discuss with you a procedure that we have been performing for several years with very good results. It's natural, it's not surgical, and it can help your body heal itself. And that is called PRP. Now, PRP stands for Platelet Rich Plasma. Now, the way that this works, in order for us to truly understand that, we have to take a step back and understand what the components of your blood are. So your blood is made up primarily of four individual components. The first one is plasma, and then red blood cells, white blood cells, and platelets. Of the four components, we are going to focus today on platelets in the form of platelet-rich plasma. In essence, what we do is we separate the platelets from every other component of your blood, and then we harness the healing power of those platelets to help your body heal itself. So how does this work? Well, when we think of platelets, we think of platelets being able to clot your blood. So if you cut yourself and you begin to bleed, the reason that you stop bleeding, one of the reasons you stop bleeding, is because your platelets actually go to that area, go to the site of injury, and very much like a flat tire, they can patch up the injury, decreasing the continued loss of blood. That is how we have all understood platelets to work. But we now understand that platelets have far more activity and use than just that. Platelets also possess something called growth factors and cytokines. Now, cytokines are basically signaling molecules within these platelets that can tell your body to do certain things. So, for example, certain cytokines can signal to your body to increase its inflammatory response, to increase inflammation. Other cytokines can tell your body to decrease its inflammation or inflammatory response. These messaging molecules combined with growth factors can help your body heal itself. Now, growth factors are basically certain molecules that are released from the platelets that actually promote healing and overall decrease inflammation. So how does this work? Well, the original studies, or some of the early studies on platelet-rich plasma for orthopedic and musculoskeletal use, really focused on the knees, the elbows, and the Achilles tendon. And what was noted is if you injected this highly concentrated platelet mixture into these areas, we began to see accelerated healing. We began to see your body healing itself. And many of these patients avoided something more significant, like potentially surgery. So basically, we're taking your body's ability to heal itself, and we're harnessing that power, concentrating that power, and then allowing that basically take place, helping your body heal itself and move forward. Now, procedure-wise, the way that this typically works is when you go in to see your physician, they will do a blood draw the day of the procedure. Then using a special machine called a centrifuge, this machine has the ability to break down your blood and separate it into its key components, the four things we talked about: plasma, platelets, red blood cells, and white blood cells. Now, the physician will simply extract just the platelets out of that mixture and then inject the platelets into the affected area. The goal will be that those platelets then release certain cytokines, certain growth factors to help accelerate the healing process and basically allow your body to heal itself, decreasing inflammation down the road. Now, as I stated, although we know PRP initially was used in the areas that I mentioned earlier, its applicability and usage now has really spread all over the human body. It can be used in the central nervous system. It can be used in other joints of the body. It's used quite often now with facials or facial treatments because the thought is injecting those growth factors can help decrease inflammation and potentially prolong more of a youthful appearance to your skin and to your tissue. But today we're not going to talk about the aesthetics. Today we're going to talk more about the orthopedic and musculoskeletal benefits. So platelet-rich plasma injections are typically done under some sort of visual guidance. So for example, if you want to inject a knee or an elbow or any other joint, it's ideal to do it under some sort of visual guidance so the practitioner or the physician can see where the platelet-rich plasma is going. Let's take a knee, for example. Your knee has many components to it. And let's say you have a tear in the medial meniscus, which is kind of a cushion based, like a small little pillow on the inside of your knee that acts as a shock absorber. Now, if you have PRP, you want to make sure you're injecting it directly where the injury lies. So in order to be very specific and clear about that, it makes a lot of sense most of the time to have an MRI done of the affected area first. The MRI will show your practitioner or your doctor where the injury is. For example, if there's a tear in the medial meniscus or a tear somewhere else in that knee, your doctor then knows where to inject the PRP. But greater than that, doing the actual injection under some sort of visual guidance, meaning an X-ray called a fluoroscopy or an ultrasound, you can actually see where the PRP is going to go in real time. And importantly, you can avoid other structures that you don't want to be near. That can include blood vessels and other nerves. So in respect to PRP, there's typically two different types. There's what we call leukocyte-rich PRP and leukocyte-poor PRP. Basically, that just means leukocyte-rich PRP is platelets and white blood cells, and leukocyte-poor PRP is platelets with minimal to no white blood cells. Now, the theory behind that is if you inject the platelets with some white blood cells, you're actually going to increase inflammation even more so than you normally would. And then theoretically, what will happen is your body's own immune system response will basically become so significant and so exacerbated that your body's intrinsic physiology and intrinsic activation of your immune system will help even more so to heal the underlying problem. And then leukocyte poor, the theory with that is you'll have less inflammation, but potentially more healing down the road. The reality is, if you look at the current data that we have and you look at the research comparing leukocyte rich and leukocyte poor PRP, the results are really not conclusive. The results in essence basically say, we know PRP works, but we don't necessarily have much clarity on if having white blood cells in the mix or not having white blood cells in the mix really changes the outcome. So what to expect after a PRP procedure or a PRP injection? Again, we'll go back to the previous example of a knee. Now, let's say you're treating that medial meniscus, which is that inside pillow of your knee. Let's say you know you have a tear on that knee and your doctor injects it. Now, what to expect? Well, typically, you're going to notice a couple things. Number one, you're going to notice potentially increased pain the day of the procedure and the next day. This increase in pain is thought to be due to the fact that you have a collection of immune system molecules like the platelets in one particular area now. So your body will actually see that collection of increased platelets in the area, and it may almost be tricked into thinking that there's some sort of new injury. And then when that happens, your body's immune system response will increase automatically. So you may feel more pain, you may feel more inflammation, and you may actually start to feel like you're getting sick, like you're getting a cold. That can last for anywhere from 24 to 48 hours after a PRP injection. That typically then goes away. But the growth factors and the cytokines are still doing their job, and the benefits of the PRP typically won't show up for about 3 to 4 weeks after the injection. Another thing on your mind might be, how many times do I need to do the PRP? And the reality is, depending on the injury of question and how bad it is and the quality of your platelets, we don't know, but you may need to do it more than once. Very common to need to do PRP more than one time, often 2 to 3 times. Think about it like this. The first injection of PRP will give you a certain level of growth factors and cytokines to help heal the issue. Now, if you repeat that PRP injection, you're actually adding more growth factors and more of these cytokine type molecules into the area, which is only going to help accelerate the healing process. And if you elect to do it even a third time, now you're adding 3 times as many growth factors and 3 times as many cytokines as somebody that's done it one time. Because you're just simply harnessing your body's own ability to heal itself, there's really no downside to doing that, and there's a big potential upside. Now, again, speak to your doctor more about that. This is strictly educational. And don't forget, the secondary way that PRP works is by almost tricking your body or confusing your body into thinking there's a new injury and increasing your body's own immune system response. So that process alone will also help accelerate the healing process. What I like to tell people when I describe how PRP works is, if you think about it like this, if you have a cut on your skin and you put Neosporin on that cut, it typically heals much, much faster. So if you have PRP and you put it on basically a cut, a tear, or anything of that nature internally, like I said, that knee example, or a tendon that might have a partial tear in it or anything of that nature, you're going to help accelerate the healing process. So PRP primarily does two things. It promotes healing and it decreases inflammation in the long run. And when it does this, not only are you promoting healing, but you're potentially going to decrease pain, which means you're going to increase mobility, decrease rehabilitation, and overall just accelerate a patient getting back to their quality of life. So PRP is so powerful that sometimes you can avoid surgery. Of course, speak to your doctor about it if that makes sense. But in certain cases, if you catch it early enough and you place PRP on an injury that's not necessarily so far gone quite yet, you can mitigate or eliminate the need for further intervention, which is amazing. Another question that may come up for the viewers is PRP FDA approved? And the answer to that is tricky, but the short answer is no. And the reason for that is the FDA is the Food and Drug Administration, right? But what is PRP? It's not a food and it's not a drug. It's simply purified components of your own blood. So it doesn't really fall into kind of the governing body or the governing wheelhouse of the FDA. It doesn't really apply. So the fact that PRP is not FDA approved isn't necessarily something to be concerned about. It just doesn't necessarily fall into that category. After a PRP procedure, you definitely want to avoid certain supplements and certain chemicals because you want to avoid anything that's going to affect the quality of your and the quantity of your platelets, right? So this can include things like vitamin E, flax oil, fish oil, vitamin A, curcumin, turmeric, and aloe. In addition, medication-wise, you want to avoid things like aspirin or any other blood thinning agent. And then how to prepare for a PRP procedure. So these are the most important components when you're getting ready to have a PRP procedure. Number one, decrease or stop any steroid medications approximately 3 weeks before the procedure. The week before, don't take any blood thinners. This can include anti-inflammatory agents. This can include aspirin, Aleve, ibuprofen, Excedrin, these types of medications. The day before, make sure you're very well hydrated and you get a lot of rest. So you'll have good blood volume the next day when you get the blood extraction for the procedure. And afterwards, you want to also avoid these blood thinning agents. You want to not smoke cigarettes or drink alcohol because these can adversely affect your blood vasculature, changing the results, potentially weakening or changing the benefits of the procedure. Now, with the rituals and routines when it comes to something like PRP, since this is a technical procedure, now depending on the underlying reason for you to consider getting something like PRP, it can certainly keep you away from surgery if it's caught early enough and if the injury is small enough or receptive enough to something like PRP, which will just keep you resilient. And overall, this process can keep you very robust. So to summarize, PRP is something that is natural. It comes from your own body. Therefore, you're not going to have any side effects to the injection because it's not a medication. It's just purified components of your own blood. So guys, I hope this was helpful for you. If you're a candidate for PRP, this is some good information for you to understand. Definitely talk to your doctor or your provider more about PRP if it's something you're considering. And I hope this was helpful. If you found value in this, please like, subscribe, and share this information to other like-minded people so we can continue to grow. And as always, guys, the best time to start something was yesterday. The second best time is today. Don't look back tomorrow with regret. Take one small step today to get yourself maximally optimized. Thank you for tuning in to this episode of the Dr. Akash Show. This presentation is for general information purposes only, does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials linked to this presentation are at the user's own risk. The content in this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay obtaining medical advice for any medical conditions that they have, and they should seek the assistance of their healthcare professionals for such conditions.